Hello again, and welcome to another episode of Wellness Wednesday with Dr. Mike Morris of Chittenden Dental in Burlington, Vermont. Today I want to talk about a simple, very important subject, oral hygiene. Oral hygiene, or oral health care, is very important, as well as bigger, higher level things like the airway and the jaw joints. So simple cleaning techniques and other things are very important, so let's talk about those a little bit. So of course, an electric toothbrush is preferred, but even a manual toothbrush with the right technique, which if you just look up in Google, BASS, B-A-S-S, like the fish, the BASS technique with a manual toothbrush, a little technique sensitive, a little tedious. That's why I think it's easier just to use an electric toothbrush. A sonic or ultrasonic toothbrush is the most preferred, as they've been shown to be the most effective. So that's a really great tip. Of course, twice a day minimum brushing. Flossing. So really talking about interdental care, so in between the teeth. The brush just doesn't go in between the teeth. So flossing is really important. Preferred flossing would be with finger floss, wrapping a nice length from your fingers to your elbow, wrapping that down really tight and making sure you have good technique going into the in-between, wrapping around one tooth, going up and down, wrapping around the other. So pushing back or pulling forward and making a C around the tooth because they're round to clean. That's why hand floss is more preferred over the little floss holders or picks, because that doesn't allow you to wrap as much. Of course, if you're not going to do anything, those picks are better than nothing, but we would prefer that you use interdental brushes. So little tiny brushes, GUM Gum brand is good. There are many brands. TEPETP brand is also good. Interdental brushes are great. They can be reused, easily stored with you when you're at work or carried with you for travel. And of course the water pick. I love my water pick. I use it every day. I think the water pick is one of the easiest and most effective ways to maintain interdental health and health of the gums. And finally, regular checkups and regular visits to the dentist. So minimally twice a year or every 6 months, and many patients, including myself, we go every 3 months. The reason for that is because the tartar, or the hard buildup, reaccumulates every 3 months. Or 90 days. So that's been studied and proven. So at that 3-month mark, it's really ideal and optimal to have that tartar buildup removed. Of course, at home you can't clean any deeper than about 3 millimeters under your gums. So you depend on us dental professionals to get into those deep areas and clean those problematic spots, which are the most harmful to your health. So on that note, any bleeding in the mouth is not normal. I think a lot of people get bleeding and they find that they just get it so often they don't think about it, they think it's just normal. It's the same thing if your skin were bleeding, just randomly if you wiped your hand, that would be probably concerning to you. So if you're not concerned that your gums bleed when you just floss them or brush them, you must think about that and think, well, I would be concerned if any part of my body bled when I just touched it, and so that's not normal. So if you have any bleeding, please check in with your dental professional and have them address that, because that is a problem. It's inflammation and it's bad for your health. So keep up with your regular dental checks, be well, and have a great day. Thank you for listening.